Over the last number of years, various research and reviews focusing on people with learning disability have highlighted the inequalities in health experienced by people with a learning disability compared to people in the general population. In fact, people with learning disabilities are much more likely to have poor health than that of their non-disabled peers. The health inequalities faced by people with learning disabilities start early in their life and result, to an extent, from barriers they face in accessing timely, appropriate and effective healthcare. In order to address these inequalities in health, GPs and health facilitators across Northern Ireland work together to offer each person over 18 years of age an annual health check. The health check is a comprehensive health assessment where each patient is allocated a 30-minute appointment to allow time for a thorough health check. To date, 68% of adults with a learning disability within Northern Ireland have received an annual health check. The purpose of this DVD is to promote this valuable service and reach out to those who are yet to avail of this assessment.
As a practice, we are actively involved in the well-being of varied groups of patients. We do involve our patients in the learning disability medicals. We invite them in for their medicals. During this period of time, a health facilitator will assess them, and then they will go through a list of questions and queries about their physical and mental health, and then they are assessed by the GP. It is a very vital service because we find that the health facilitator will delve into areas that we don't have time to delve into during our 10-minute consultation. They would assess basic conditions. They also go into much more specific things, and they may be minor issues but have a major impact on the person's well-being, such as visual problems, hearing problems, gait problems, and the other range is the social side of things and the input of social services. They also are an excellent source of information in relation to screening for women. They'll encourage them about breast screening, cervical screening, and this is an area that we find a lot of women who have learning disabilities are quite anxious about because it's fear of the unknown. They aren't aware of what it involves. Is it going to be sore? So the health facilitator will put them at ease and address those issues even before we see them in the surgery. The other side of the coin is, as a female GP, the issue of the menopause for patients with learning disabilities. It's a very important aspect of the lifestyle for the women, and we find that the health facilitator will address that issue, and then of course any concerns or queries that they have will be raised with us during the medical consultation.
Hi, my name's Geraldine, and I take my sister Annette to Newry for a health check, and it's a yearly one, and we would go into the clinic where we would be see Bria, our health facilitator, and she would do sort of the pre-op type things of just getting to talk to us and getting to know us. She takes bloods and different things like out there, blood pressure and that for Annette. Then when these things are all done, we go in and we see the GP. Now we've been going down on a regular basis, and Annette is very comfortable with going here. She doesn't have any fear in going here. She actually gets to know the staff and the receptionist and the health facilitator Bria, and we go to and see the GP then, and he does all the checks, which is great because Annette gets a full overhaul, her blood pressure, her hearing, her eyesight, her breast checked, everything.
I think that probably one of the biggest benefits that we have found out from having learning disability clinics in the doctor's surgery has been building relationships with the people with learning disabilities and their families. We started about 2009 with the clinics with the help of the health facilitators, and over the years we have built relationships and confidence both with the facilitators, with the patients, with their families, and we've got to know them, and probably they trust us and talk to us now definitely a lot easier than they did in the beginning.
We have an excellent attendance rate at the practice of 98%. So to achieve this actually involves commitment and dedication from our GPs, the same from our admin staff, who offer a gentle and timely reminder and use their judgment and discretion and have a flexible approach to the appointment times for the patients.
I'm working in the Western Trust as a health facilitator, and my role involves visiting each GP practice within my allocated area and assisting the practice manager to identify adults with a learning disability within their practice population. Once identified, the clinics are set up with the GP, and We work then with myself seeing each patient first, or the practice nurse, and then the GP will see each patient for a physical examination and medication review if needed. Patients also have an opportunity to have bloods done at these clinics and ECGs if needed. To date, a number of people province-wide have been identified with prostate, testicular and breast cancer. In addition, a significant number of individuals have been diagnosed with type 2 diabetes, hypertension and high cholesterol.
I had a circumstance where the learning disability reviews really helped me with a patient. This was a man in his late 60s, and he'd been found to have lost a fair bit of weight when we reviewed him. And we were suspicious enough to do a PSA, which really came back alarmingly high. The problem was we couldn't get him back to the surgery, and he wasn't really appreciating the gravity of this. And the learning disability health facilitator actually went to his house and picked him up and brought him round, where we were able to examine him, found that he had a very, very malignant feeling prostate. We referred him to urology, and the health facilitator then actually went to the appointment with him and sat and made sure that the urologist understood the situation and that he understood what was going on as best that he could. And I don't know how this would have worked without that service. We couldn't even get him down to the surgery, let alone getting him to Craigavon and starting injections and having radiotherapy, but all that has happened through their support and the LinkedIn social workers and nurses as well, who have really helped him. So I definitely saw the benefit of picking up things that definitely would not be picked up otherwise. And I think from that point on, I realised that there was a really, really active and available service that we as GPs could use.
Health check is like an MOT, I suppose, top to toe, head to toe assessment and review. I was glad I was there as a carer because somebody else, yes, could have taken her, but me being her mum, I can add in the communication difficulties or clarify the communication difficulties for Carly. I also know her health situation best, as opposed to any of her other carers who might have gone with her. And I have to say the doctor was very patient. We did a lot of discussion about ongoing health issues, any new health issues. We looked at were there any screening issues, because now she's 25, you can come into certain screening situations. I felt as a mum my views were taken on board and I was able to discuss any concerns I had. We also then had an opportunity to discuss about the care package that Carly has, and was there anything that the GP could do to support. So I would say all in all, for me it's been a positive experience. It can't be that bad, because as we walked out the waiting room, another family that I know were coming in. So obviously in this area it's going down quite well, and I would just say to people, take the opportunity and go along. It only takes an hour max between the waiting and the discussion with the GP, and it can satisfy and clear your mind of any worries you might have.
It's amazing how many people not only don't avail of this service, but aren't aware of this service. And I can't emphasise enough just how important it is. It's only once a year, for an hour, you meet all the professionals, you're able to talk confidentially and at ease, and you're able to cover all aspects of the young person's life.
The annual health check has many very positive benefits for our patients with an intellectual disability. It makes a reasonable adjustment to allow their access to healthcare. It establishes a familiarity with attending the general practitioner's surgery. Identifying and the ongoing treatment of physical health problems has a very positive effect upon mental well-being. As well as that, the annual health check allows unrecognised mental health conditions to be picked up and for appropriate referrals to be made. It also improves the ongoing management of chronic mental health conditions and their associated physical health complications.
25% of people with a learning disability experience epilepsy and seizures. An annual health check from your GP is important in the management of seizures. The GP can monitor and review anticonvulsant medication. If there are any concerns or side effects that are experienced by people, this can be addressed at the review with your GP. We also have an opportunity then with the GP to monitor bone health. This can be done through a simple blood test, and people who are on long-term anticonvulsant medication should have this checked.
Following an annual health check, patients with a learning disability and their carers may be signposted to the Promote Wellbeing services, which can improve their health and wellbeing. Some of these services would be the likes of our smoking. You can be referred to our smoking cessation services. We've got physical activity, and we've got a dedicated Fit For You programme specifically for learning disability. We've also information on healthy eating. One of the programmes that we deliver is called I Can Cook It. This is an education community nutritional programme. In terms of mental health and wellbeing, we've got information and resources on the Take 5 programme. We recently worked with the health facilitators to develop this into an easy read version for our clients with learning disability. All these can be included in an individual health and wellbeing action plan for adults with a learning disability. You can also access any of this information through the Healthy Living section of any of the Trust websites within the region.
Thank you for your time today. I hope you found this DVD valuable, and I hope it has given you some insight into what healthcare assessment will entail.